The following segment is sponsored by Healthy in Utah. Welcome to the show, everyone. I'm Brooke Mangum, and I think it's safe to say as a society we've never been more focused on health and staying well. And here to help our families do just that is Dr. Greenwood. Thank you so much for joining us.
Thank you for having me.
So I think a lot of us are very focused on obviously coronavirus, and rightfully so, but we're coming up to just cold and flu season, and there's some preventative care that we need to be aware of.
Absolutely. I appreciate you bringing that up. COVID avoidance is important, but there is more to being healthy than just avoiding COVID. All of our normal other viruses and bacteria and cancers and other screenings and diseases, they have not gone into quarantine, and they do not know there is a pandemic.
Well, and there's so many of us that just are nervous about leaving their houses, and rightfully so, but maybe even going to the doctor's office. Have you been seeing a drop in people coming in for their wellness exams and maybe even their vaccines?
A little bit, yes, especially in the spring. Now, fortunately, that started to creep back up. And I do want people to just know and realize that it is probably safer now than it's ever been to go to the doctor and get your preventive care and these other vaccines and screenings. There's now screenings at the door and temperature checks and cleaning procedures and visitation changes and masking. I suspect now is safer than it has ever been to go to the doctor.
I'm so glad that you brought that up, because I have a little soon-to-be one-year-old. I can't believe I'm actually saying that. And she had a wellness exam coming up, and she had vaccines that were in order. And I'm going to be honest with you, I was really nervous about taking her there. I was just not wanting to take her to the doctor's office. Called my pediatrician, and she said what you said. This is important. You need to go. So we loaded up little Ava in the car, and I drove on down. And my experience was just that. I have never felt better about being in a doctor's office. It was clean. They ran that thing like a machine. There was no contact, and I really did. I felt so safe.
I'm so glad to hear that. And there is one particular message, since you are talking about kind of kids and vaccines, that we're trying to get out right now. Cold and flu season, like you said, is coming. And this year, more than ever, it is important to get a flu shot. So my biggest plea right now for folks as they're looking at the fall is everybody over the age of 6 months, please get a flu shot this year, even if you've never done it before.
Okay, that's what I was going to ask, is what's the age frame? So 6 months all the way through?
6 months through 106.
Is there a time that's the better time to get a flu shot?
Ideal is kind of end of September, maybe first part of October, but honestly, the biggest thing is just to get one this fall, more so than any time. So today or any day is a great day to get a flu shot.
Okay, what if some of us have not been to the doctor for a while, and we're maybe unsure of what vaccines we're supposed to have, or maybe we don't even know if we need to have a wellness exam? Is there a way that we can find that out?
Well, absolutely, and there's lots of websites, intermountainhealthcare.org. When in doubt, though, if you haven't been to the doctor for a while, make an appointment, go in, get a physical and a checkup, and your pediatrician or your family practice or internal medicine provider can sit down and go over with you, based on your age and gender and family history and other risks, what are the important screenings and treatments, vaccines that you need to get to help you stay well in all areas, including avoiding COVID.
Okay, so as a doctor, I got to ask you, if there's one thing that we do as a family to help us keep well, what would it be?
Eat healthy and get exercise.
Oh, okay, it always goes back to that every time. Oh, I love it. Well, thank you so much for your time and sharing all this great information. If you want more, you can go to the website on your screen. Thank you so much, Dr. Greenwood.
Thank you for having me.